Okay, this presentation is about sublinguals and their advantages as well as the proper use of them. Okay, first, why are they the best delivery system available? This is because hormones are small in molecular weight and they're very lipophilic, being derived from cholesterol in your body. The two criterion for a sublingual absorption just happen to be those two things. So that's why they absorb very well under the tongue. They do work, as previously mentioned, by absorbing through the sublingual gland, which is a direct pathway to the bloodstream. So therefore it bypasses the liver and goes straight into the blood. And this avoids something called the first pass effect, which is if you took something by mouth, the great bulk of it is extracted by the liver. And this avoids it much like an injection would avoid it. So those are some of the huge advantages of using sublingual. You get the advantage of no first pass effect, ease of use, and yet you don't have any painful injection or anything of the sort. Okay, for sublinguals to work, you need to maximize the contact with the sublingual gland. And in order to do that, you need to keep the tablet under the tongue for anywhere from 2 to 5 minutes. It needs that kind of contact to absorb correctly. The dissolution, it should be completely gone after 5 minutes, if not earlier, but it shouldn't be dissolved much earlier than 2 minutes. Otherwise, you don't get the full absorption that you're looking for. Also, the time until the onset of action is actually fairly rapid. You noticed some absorption within 20 minutes, which is much quicker than an oral dose typically. Okay, we have a slide here basically showing you how to use a sublingual tablet. Ours is a little different, or we make a little bit different recommendation. We like our patients to split the tablet right along the score and to put both halves under the tongue and then allow it to dissolve. We also recommend that our patients drink a glass of water before using the tablet, and this is to provide some moisture which will help the breakdown of the tablet. Splitting the tablet helps to break that outer sheen or that outer coating, so dissolution is a little bit more rapid. Okay, factors that can negatively affect the absorption of a sublingual. Too dry of a mouth, incomplete dissolution, probably from the tablet being too hard, lack of contact time with the sublingual gland, meaning you moved it around too much under your tongue. And again, we mentioned a tablet that would be compressed too hard by a machine to disintegrate properly. Okay, so to sum up, advantages: highly and rapidly absorbed, easier to use and much more accurate than topical. They're dosed twice daily, and this is important because hormones are generally excreted twice a day in a diurnal pattern. So we can mimic physiology correctly by using a sublingual 2 times daily. Again, it bypasses the first pass or the liver extraction that an oral has. And it's very consistent from patient to patient. We can tell you what kind of absorption you're going to get based on another patient, which is excellent because most dosage forms aren't that way. And if you have any other questions, please feel free to contact us and we'll go over it further with you.